this is Dr. Beltran. Today we will be talking about a supplement that I use a lot known as alpha lipoic acid. Alpha lipoic acid is a great supplement. It really does wonders, I've been using it for many years now, and it's part of the leaky gut syndrome protocol. The way how I ended up getting familiar with this supplement was after reading a book that was written by a U.S. doctor, an American physician by the name of Dr. Berkson. He wrote a book called The Alpha Lipoic Breakthrough, and it just made me really curious. I wanted to see, what this could actually do to my patients and see if I could actually benefit them and give them something that could perhaps enhance their liver metabolism and also heal many other problems that they also had in their autoimmune condition. So alpha lipoic acid, as we know, is something that is made naturally in our body. We can get this as a form of a supplement. There are different forms of it. We have three different forms of it, which is the natural form, the synthetic form, and a combination of the natural with the synthetic. Also known as alpha lipoic acid R, which is the natural one, and alpha lipoic S, which is the synthetic one, and the combination of both. Okay, so alpha lipoic acid is something that is made in our body, but we can take it as a supplement, and it's very safe. Now, the way how alpha lipoic acid works, it's just basically a very potent scavenger. It's a potent antioxidant. It helps in the Krebs cycle, and it works at the level of the mitochondria. But before we get into that, I would like to go ahead and tell you a little small story of Dr. Berkson and how his experience actually had a profound impact on many different patients. And it all started off when he was doing his residency at the Cleveland Clinic, if I'm not mistaken. And two patients arrived who had eaten these very toxic mushrooms. They caused a fulminant hepatitis, and this also, as back in the early 1970s, there wasn't actually any real treatment for this, and usually people who ate these types of mushrooms died. So the chief resident at that time had told him, hey, you know what, have you ever seen a person die after consuming these types of mushrooms? And he said, well, no, I want you to go ahead and follow up these two patients, because it was a man and a woman who were married that had consumed these mushrooms, and unfortunately they got very sick. So Dr. Burt, he decided to go ahead and see if there was something else that perhaps was out there that could probably help these patients. He was very concerned for their health. So he ended up, calling the NIH and asked if there was something that could probably regenerate liver. And the NIH told him, that there was some research that was being done, and there was a substance, a supplement that perhaps, could help regenerate a liver. And that was alpha lipoic acid. But that was still under testing. There wasn't something that was being used in humans to see if it really had a very profound impact or not. So he said, okay, please go ahead and send it to me. And he went ahead and administered the alpha lipoic acid intravenously. And the patients eventually started to show signs of improvement. So then his chief resident came up to him and asked him, after I think about a week or so, how were his patients? And he said, well, they're doing much better. They're still alive, and their liver is recuperating. And obviously, the chief resident was, I think, surprised to see such an improvement in his patients, and even got a little bit angry, because he went against a little bit the hospital's rules, by using a medication that was not formulated in the hospital as well, that wasn't in the guidelines that they used, I guess, But so that was one of the great stories that Dr. Berkson always mentions, Another fascinating story was that he was working at a hospital, and he was at this specific hospital. They did liver transplants, and since he had that prior experience of noticing that alpha lipoic acid could reverse fulminant hepatitis, he decided to go and see if he could use maybe get some offer some benefit to these patients who were on a waiting list in order to get a liver transplant. So there were a total of, I think, if I'm not mistaken, around 78 or 79 patients that were waiting to get a liver transplant. He gave them alpha lipoic acid, and incredibly, out of the 79 patients, I think it was something like 73 or 74 patients didn't require a liver transplant at all. So that was a remarkable, that's an amazing story, you know? I mean, where do we see that on a daily basis, right? So that was another story. Then eventually Dr. Berkson decided to go ahead and do some treatments with a substance known as a low-dose naltrexone, something that I am also familiar with, and that's actually one of the reasons why I got into LDN many years ago, in treating patients who had cancer. So he was treating patients with alpha-lipoic acid and low-dose naltrexone in combination of a special diet and also some other supplements that were necessary as well. But one of the patients that he treated was a patient who had terminal pancreatic cancer with metastasis, and he was able to reverse it. You know, there's an article that's published out there circulating on the internet. You can probably find it on Google Scholar. All you gotta do is just put Berkson, you know, pancreatic cancer, and it probably should pop up. So it was fascinating to see how alpha-lipoic acid also has an anti-cancer, you know, property. So go ahead to speaking a little bit about what the benefits and functions of alpha-lipoic acid are, is that we know it's a lipid antioxidant, okay? It also is very important for neuropathy, and it also counters what we know as oxidation. And it liberates all those it gets rid of all those free radicals that we have in our body. And the beauty of it, it also goes into the brain. It crosses the blood-brain barrier, alpha-lipoic acid. And it also protects the myelin sheath that we find in our nerves. So whenever you are, having problems with the production of myelin, and there are certain diseases that are characterized by this, such as multiple sclerosis, this myelin sheath starts to get worn down, and they start having problems with, electrical nerve conduction, right? So this causes a problem with weakness down the road and throughout the years. So alpha-lipoic acid is a great supplement. It helps, reduce all this oxidation, all of these free radicals. It's an antioxidant. It also protects the myelin that's found in these nerves. And whenever I talk about patients who have, myelin problems, I always recommend combining it with another vitamin known as, it's a synthetic form of vitamin B1 known as benfotiamine. When you combine these two supplements, you really get to see the benefits of more myelin synthesis or production of myelin for these patients. So any patient who has MS over there, or if you're a diabetic patient, we know that alpha-lipoic acid has a very important role in regulating what we know as insulin sensitivity. So if you are a patient who has diabetes, alpha-lipoic acid is going to be able to lower down those A1C levels, and your blood glucose levels are also going to start getting better. And if you have, diabetic neuropathy or polyneuropathy in your extremities, alpha-lipoic acid is great for that. So if you are a diabetic patient, you really need to be on alpha-lipoic acid. And if you would like to go ahead and combine that with benfotiamine, I think that would be something that you should be considering, okay? So when we take this supplement, we make it obviously, like I just mentioned, in our body. But when you're taking this as a supplement, you're taking like 1,000 times more of it. It's a really powerful antioxidant. It's not only just an antioxidant, but it's also a detoxifier. It takes out all those heavy metals that we sometimes accumulate throughout the years, like mercury, for instance. And alpha-lipoic acid, it acts as a scavenger, and it also rejuvenates and recycles glutathione and vitamin E. So whenever you combine alpha-lipoic acid with vitamin E or glutathione, you really get a huge, humongous benefit for your liver. Let us not forget that sometimes a lot of people have this, people who have, migraines or headaches, chronic migraines, sometimes they end up consuming medications such as, Tylenol on a regular basis. And as we know, Tylenol, it depletes your glutathione reserves that you have in your liver. So if you're one of those patients that's always taking Tylenol in order to be able to treat those headaches that sometimes, or migraines that you have, don't forget, you're actually doing some harm to your liver, and you're depleting your glutathione. So alpha-lipoic acid is something that you want to have on board, because it's a scavenger. Not only that, it's also recycling all of that glutathione that you need, and also vitamin E. And when it comes to vitamin E, I always refer to trying to use a natural form of vitamin D. We have synthetic form of vitamin E, which is some not the best form of it, you always want to go to a natural form of vitamin E. Okay. So what is my recommendation in regards to alpha lipoic acid in regards to its dosage? I always tell people, if you want to get started on it, 600 milligrams twice a day or 3 times a day would be a good start. Okay, so that's it for today. I hope you guys liked the video. Please give it a like and share if you'd like. Alpha lipoic acid is something that I've been using for many years, and for basically all my patients who have some form of autoimmune disease, because it enhances liver metabolism in phase 1 and phase 2, and it's very, very important in order to make sure that liver is working properly. Let's not forget, the liver is the laboratory of our body. Okay, so we have to treat it right, and alpha lipoic acid does just that. Okay, until next time, see you guys.